People who have somehow been affected by this illness in one way or another have also found some comfort. They are not alone, we are all with them. So Vaimas, you guys can ask questions and comment. And if you feel that there is someone around you, God forbid, who is facing this issue, I will definitely tell you where you can refer them. I will provide those addresses at the end, and then you can refer them there. HIV and AIDS are topics we've encountered. AIDS is often seen as a death sentence. Once diagnosed, life seems over. The concept that AIDS is a death sentence has ingrained itself in our genes, to such an extent that we truly believe that once someone has AIDS, their life is essentially over. Along with this, we used to watch one more ad. It was believed that our relationships are limited to bodies, which implied that AIDS or HIV is an issue, a germ that only spreads through sexual contact transmitted from one person to another through sexual relationships, while in reality, today we will discuss that HIV is a germ, it is not a disease. Firstly, it is a germ that can be transmitted from one person to another through non-sexual contact, while in reality, today we will definitely discuss that HIV is a germ, it is not a disease. First of all, it is a germ that can be transmitted from one person to another due to non-sexual relationships. Along with that, it can be transmitted from one person to another through non-tested blood and through the use of used syringes. And interestingly, in Pakistan, you will surely agree that the biggest reason for the spread of this disease, which is very evident to us, is the use of non-tested blood and the reuse of used syringes, which is very common. In Pakistan, these practices, which we refer to as male sex work, are definitely present, and there is no doubt about it. It is a germ that spreads from one person to another due to sexual contact. But for this germ to attack, certain conditions are required. It does not happen that this germ attacks immediately and quickly. In some special circumstances, this germ cell spreads from one person to another, which is a germ cell or hives. It happens just like in common people. As in normal days, we get cold, cough, and fever. When a person gets infected with HIV, the virus starts to show symptoms similar to a common cold, cough, or fever. This can lead us to mistakenly think that the person might have contracted the HIV virus. As soon as HIV enters a person's body, it begins to manifest itself, the body's ability to fight against diseases, which we call immunity, starts to decrease because the job of this virus is solely to weaken the immune system. It is not a disease itself. Its function is to reduce immunity. As a person's immunity decreases, they move closer to the AIDS stage, meaning they start to progress towards the AIDS stage. At the AIDS stage, a person can become susceptible to various diseases, from the smallest ailments like a cold or cough, to more serious diseases like tuberculosis, cancer, and other severe illnesses. At the AIDS stage, a person's death can also occur. However, all of this happens when a person is not taking any medication. If someone has HIV and is not taking their medication, they could face death within 8 to 10 years, or sometimes even in 5 to 6 months under certain conditions. In Pakistan and around the world, there are medications available that provide a very effective treatment for HIV and AIDS. If managed well, these medications are completely free. By taking these medications, a person can live for 20, 25, or even 30 years. They can live their life fully, and in every way, they can lead a good and healthy life comfortably. Interestingly, I would like to tell you that the first case in Pakistan was reported in 1995, and it was of a woman, and that woman is still alive today. Even today, she has raised her children to be adults. She is a very famous personality in Pakistan.